Hey everyone, it's Dr. Mike. We always hear about the importance of heart health, but did you know that a heart attack can happen without the classic symptoms we often associate with it? That's right, it's called a silent heart attack, and it can be just as dangerous because it often goes unnoticed. These silent heart attacks don't always present with the crushing chest pain you see in the movies. Instead, they might whisper with subtle signs that are easy to brush off. In this video, we're going to uncover 10 of these easily missed warning signs. Recognizing them could be the difference between life and death, so stay tuned. Let's talk about the first warning sign: unexplained fatigue. If you're constantly feeling drained, even after a good night's sleep, it's worth paying attention to. This isn't the kind of tiredness that goes away with a cup of coffee or a quick nap. It's a deep, persistent fatigue that lingers throughout the day. This isn't just about feeling a little sleepy, it's about a persistent lack of energy that interferes with your daily activities. You might find it hard to concentrate at work, or you might feel like you need to take frequent breaks just to get through the day. This kind of fatigue can be your body's way of telling you that your heart is working harder than it should to circulate blood. When your heart isn't functioning properly, it can lead to a lack of oxygen and nutrients being delivered to your muscles and organs, causing you to feel exhausted. It's crucial to consult your doctor to rule out any underlying heart issues. Early detection and treatment can make a significant difference in managing your health and improving your quality of life. So, if you're feeling unusually tired, take it seriously and seek medical advice. Now, while a full-blown heart attack often brings on intense chest pain, a silent heart attack might manifest as mild discomfort in the chest. This discomfort can feel like pressure, squeezing, or a burning sensation. It's important to remember that this pain might not be severe or long-lasting, which is why it's often mistaken for indigestion, heartburn, or even muscle strain. You might feel it for a short period, and it might go away on its own, only to return later. This on and off nature can make it easy to ignore, but any recurring discomfort in the chest, no matter how mild, should never be taken lightly. If you experience this, even occasionally, it's crucial to consult a healthcare professional to determine the cause. Warning sign number 3 is shortness of breath. This is a big one, guys. Finding yourself suddenly gasping for air, even after minimal physical activity, is not normal, and could indicate a silent heart attack. Imagine this: you're walking to the mailbox, a task you've done countless times before, and suddenly you feel like you can't catch your breath. Or maybe you're simply relaxing on the couch and find yourself struggling to breathe deeply. This shortness of breath happens when your heart isn't pumping blood efficiently, causing fluid to build up in your lungs. It's easy to brush this off as a sign of getting older or being out of shape, but it's a serious red flag that needs immediate medical attention. Next up, we have pain in the neck, jaw, or back. These symptoms are often mistaken for muscle strain or other common ailments. It's easy to dismiss them as something minor, but pain radiating from your chest to your neck, jaw, or back should never be ignored, especially if it's persistent or sudden. This isn't just about discomfort, it's about understanding what your body is telling you. This type of pain can be a sign of a silent heart attack, particularly in women. Women often experience heart attack symptoms differently than men. It might feel like a dull ache, a sharp stabbing sensation, or even a burning feeling. Sometimes it can be accompanied by other symptoms like shortness of breath or nausea. The key takeaway here is this: if you're experiencing pain in these areas, get yourself checked out by a doctor to rule out any cardiac issues. Early detection can make a significant difference in treatment outcomes. Moving on to warning sign number 5, nausea or vomiting. Now you might be thinking, Dr. Mike, isn't that a common stomach bug symptom? And you're right, it can be, but it's also a symptom that can accompany a silent heart attack. Here's why. When your heart isn't getting enough blood flow, it can disrupt your digestive system, leading to feelings of nausea, vomiting, or even a general sense of uneasiness in your stomach. Now, if you experience these symptoms in isolation, it's likely not a heart attack. But pay close attention if you're also experiencing other symptoms on this list, like shortness of breath, chest discomfort, or pain radiating to your arm or jaw. In those cases, it's crucial to seek medical attention immediately. Let's talk about feeling lightheaded or dizzy. Ever feel like the room is spinning, even when you're perfectly still? That's dizziness, and it's a common symptom that can have various causes. But when it comes to your heart, dizziness can be a sign that your brain isn't getting enough oxygen-rich blood. This can happen during a silent heart attack when blood flow to the heart is compromised. If you experience sudden dizziness, especially if it's accompanied by other symptoms like chest discomfort, shortness of breath, or nausea, it's crucial to seek medical attention right away. Alright, moving on to warning sign number 7, cold sweats. This is one of those symptoms that can easily be overlooked or mistaken for something less serious. We all sweat when we're hot, exercising, or feeling anxious. It's a natural response of our body to regulate temperature or react to stress. But breaking out in a cold sweat without any of those triggers could be a sign of a silent heart attack. This type of sweating is different because it happens without any obvious cause. Imagine sitting calmly, maybe reading a book or watching TV, and suddenly you're drenched in a cold sweat for no apparent reason. It's sudden, intense, and alarming. This happens because your body goes into overdrive when your heart is struggling, your heart might not be getting enough blood, and your body reacts by triggering a cold sweat. It's like your body's internal alarm system is going off, signaling that it needs immediate attention. If you experience cold sweats without any obvious explanation, don't ignore it. Seek medical advice immediately. Early detection can make a significant difference in treatment and outcomes. Now, this next warning sign is a bit more subjective, but it's important nonetheless. We're talking about unexplained anxiety or a sense of impending doom. Many people who have experienced a silent heart attack report feeling a sudden wave of anxiety or a feeling that something bad is about to happen, even when there's no logical reason for it. This feeling can be incredibly unsettling and difficult to describe, but it's like your body is sending you a warning signal that something is off. While anxiety itself is not a direct symptom of a heart attack, experiencing it alongside other symptoms on this list, like chest discomfort, shortness of breath, or nausea, should never be ignored. Let's talk about swelling, particularly in your legs, ankles, or feet. Now, some swelling in your lower extremities is normal after standing or sitting for long periods, especially during warmer months. But if you notice persistent swelling, especially if it's accompanied by other symptoms on this list, it could be a sign of a silent heart attack. This type of swelling, known as edema, occurs when your heart isn't pumping efficiently, causing fluid to build up in your body's tissues. If you press on the swollen area and it leaves a dent that slowly disappears, that's a telltale sign of edema. It's essential to consult your doctor if you experience this type of swelling, as it could indicate an underlying heart condition. Last but not least, we have irregular heartbeat or palpitations. We've all experienced that feeling of our heart skipping a beat or fluttering in our chest. While occasional palpitations are usually harmless, frequent or persistent irregular heartbeats, especially when accompanied by other symptoms on this list, could be a sign of a silent heart attack. During a silent heart attack, the heart's electrical system can be disrupted, leading to an irregular heartbeat. If you feel like your heart is racing, pounding, or fluttering, or if you experience a feeling of skipped or extra beats, it's crucial to consult a doctor to rule out any underlying heart conditions. That wraps up our look at 10 warning signs of a silent heart attack. Remember, these signs can be subtle and easily dismissed, but recognizing them early can be life-saving. If you experience any of these symptoms, don't hesitate to seek medical attention. Early detection and treatment are crucial for preventing further damage to your heart. Take care of yourselves and stay informed. And as always, thanks for watching.